Hey, what is joint fixation and what does it have to do with you? Did you know that every single one of the joints in your spine is built to move? Unfortunately, one of the most common and silent killers is joint fixation. That's where, instead of having a properly moving joint, the joint becomes locked down. And when that happens, we often don't know about it because it doesn't give any kind of signal to your brain saying, hey, there's something not working properly, until enough damage has happened. And by that time, it can oftentimes be too late. One of the first symptoms of a joint fixation is, think of it like a pulley. So when you have a pulley and the wheel isn't moving properly, it works really hard on the rope, and then the rope starts to fray. Same thing happens with your muscles. So eventually, what ends up happening is the muscles end up having sprains and strains, which instead of treating the fixation, we oftentimes just do things like massage, or we'll take a muscle relaxer or a painkiller, but then the joint's still locked. And when that happens, the disc is drying out and the degeneration process has begun within 24 to 48 hours, eventually turning that joint into something like this, where the joint is now thinner and the disc is worn away and there's more arthritis happening in that joint. And if it's not detected or corrected at this point, which is called phase 1 arthritis, it then will turn eventually into phase 2. And in phase 2 arthritis, the joint's even more stuck, there's more bone spurs, more pain, more problems, and more pressure on those nerves. And since those nerves go to important tissues and organs, it's impossible to have a healthy organ at the end of a sick nerve. So we want to make sure at this point that you're mitigating that damage and getting that joint moving. But at this point, if it's not fixed, it turns into full fusion. Now usually at this point when it's fused, this is where surgeries happen. This is where organs start to fail. So it's really important to make sure that you're taking care of your joints before there's a problem. The earlier, the better. And I always feel like if you maintain something that's healthy before it gets sick, that it's even a better issue than waiting until it gets damaged in the first place. So if you haven't taken a look at how your joints of your spine are moving, then it's important to have what are called motion study x-rays. On motion study x-rays, you can actually see which joints are moving versus which ones are not moving, and make sure that you're doing a care plan that's created specifically for you. So instead of chiropractic that's designed just to treat symptoms or pop and crack areas that hurt, we're looking at fixing the spine from a functional basis and making sure that there's an integrated approach. And that means chiropractic and physical therapy and rehabilitation using nurse practitioners, PTs, chiros, and MDs all together under one roof where we can fix the cause of your problem. So if you haven't had your spine checked for spinal fixations, give us a call and we'll help you out. Have an awesome day.